what if something as, well, fundamental as the health inside your mouth is directly linked to the health of your brain?
Yeah, specifically thinking about cognitive decline, it might sound a bit out there at first.
But researchers are really starting to dig into this connection, aren't they?
Yeah.
Moving beyond just noticing a link.
Exactly. They're looking at specific factors, how they relate to the different stages of cognitive change.
Right. So today we're doing a deep dive into some really fascinating new research. It explores this intricate relationship between oral health factors and, well, the whole spectrum of Alzheimer's disease.
All the way from just subjectively feeling forgetful through to, measurable issues and right up to diagnosed dementia.
And the source for this is brand new research, just accepted actually. It's an article titled Oral Health Variables Associated with Factors Across the Alzheimer's Disease Continuum, from Subjective Cognitive Decline to Dementia.
Published in the Journal of Dentistry, Wu et al., 2025. And it offers some pretty compelling insights, I think.
Definitely. So our mission here is to pull out the core findings from this study and, really importantly, understand what this could mean clinically.
Especially for dentists, right? What are the practical nuggets, the takeaways that dental professionals can use in their practice?
Exactly. What should they be looking closer at based on this?
Okay, so this study, it was done in Taiwan. They looked at a group of people aged 60 and older, and they were careful to categorize them based on cognitive status.
Right. There were 4 groups. You had the cognitively healthy controls folks with typical memory and thinking for their age.
And the SCD group, that's subjective cognitive decline. These are people who feel like something's slipping cognitively, but standard tests don't really pick up major issues yet.
Kind of that very early self-perceived stage.
Precisely. Then came mild cognitive impairment, or MCI. Here you do see measurable deficits, memory problems, maybe slower processing speed.
But not bad enough to seriously mess with daily life yet.
Correct. And finally, the AD group. Diagnosed Alzheimer's disease, significant impairment affecting daily function, independence.
So 4 clear points along that path, from healthy aging to dementia.
And within these groups, they did really comprehensive oral health checks.
What kind of things did they measure?
Well, number of missing teeth, for one. And importantly, they looked at natural tooth loss separately from teeth still missing after fixed restorations, like bridges. So, unrestored gaps.
Okay, that distinction seems key. What else?
Occlusal support, using the Eichner index. Basically, how many zones in your mouth have teeth biting together, either natural teeth or prosthetics. Functional chewing surfaces.
Got it. How well you can actually bite down.
Yep. And masticatory performance, how efficiently you can chew. Salivary flow rates, too.
And the usual suspects? Perio.
Oh, yeah. Full periodontal workup. PPD, CAL, bleeding on probing, plaque index, and the classic DMFT score, decayed, missing, felled teeth.
Okay, quite a thorough assessment. So let's get to the findings. What jumped out?
One of the really strong links was with natural tooth loss. This was quite striking. They found a significant link between having lost more than 14 natural teeth and being in one of the cognitively impaired groups. And look at the odds ratios adjusted for age and sex.
Huh?
Compared to the healthy controls, the odds of being in the SCD group if you'd lost over 14 teeth were 1.45 times higher, a noticeable increase.
Right. A start?
But then for the MCI group, the odds jumped to 4.69 times higher.
Wow. Nearly 5 times.
And for the AD group, it was a staggering 10.1 times higher.
10 times. Just from losing more than 14 natural teeth.
Yeah. The author specifically flagged this. They said it suggests a potential dose-response relationship.
Meaning the more teeth you lose, the higher the likelihood of being further along that cognitive decline path, at least in this study population.
Exactly. That dose-response idea feels, well, incredibly important here.
It really makes you stop and think about the impact of significant tooth loss.
It does. And then there's the unrestored tooth loss point. Even after fixed rehab, counting the teeth still missing.
What do they find there?
Having 6 or more unrestored missing teeth was also significantly linked to MCI odds 4.61 times higher and AD odds 4.70 times higher.
So again, it's not just losing them, but not replacing them seems to be a critical factor here.
That's the strong suggestion, and it's backed up by another really interesting bit. They reran the analysis, but this time included all kinds of dental rehab, so likely removable dentures too.
And what happened?
The association between missing teeth and cognitive impairment got weaker, quite a bit weaker actually. The odds for MCI dropped to 3.23, and for AD they went way down to 1.82.
Okay, wait, so if you had some kind of replacement, even dentures, the link to cognitive issues wasn't as strong as leaving those gaps.
That's what the results imply. The paper calls it a mitigating effect of dental rehabilitation. It suggests that replacing missing teeth, maybe in any form, could lessen that association compared to just leaving lots of teeth missing.
That seems like a massive clinical point right there. Don't just count missing teeth, count the unrestored ones.
Absolutely. Then there was the occlusal support finding using that Eichner index.
Right, the biting zones.
People in categories B or C, meaning significant loss of those opposing contact zones, especially in the back, had odds 5.48 times higher of being in the MCI group.
Over 5 times again for MCI.
And a strong trend towards higher odds, almost 4 times higher in the AD group as well.
So it's not just having teeth, but having them actually meet and function seems really important. Why is that? Just chewing.
Well, chewing efficiency itself, masticatory performance, was also linked to worse cognitive status in their trend analysis. But the focus on occlusal support might go deeper.
How so?
The authors and other research they mention suggest that functional occlusion gives important sensory feedback to the brain, through the ligaments around the teeth or implants.
Ah, that tactile feedback when you bite.
Exactly. Losing those contacts might mean losing that stream of sensory input, which could potentially play a role in maintaining cognitive function.
That makes intuitive sense. The brain thrives on input. Losing a major source like that. Yeah.
Precisely. They also did an analysis looking across the whole spectrum control, SCD, MCI, AD, an ordered logistic regression.
To see the overall trend.
Yeah. And it confirmed that worsening oral health tracked with worse cognitive diagnosis. The biggest factors linked to progression were losing more than 14 natural teeth,
Okay.
having more than 6 unrestored missing teeth,
Right.
being in those lower Eichner BC categories for occlusal support,
Makes sense.
poor chewing performance, and higher DMFT scores. Those all lined up with increasing severity.
So those factors seem to track pretty consistently. Did anything specific stand out for the very early stage, the SCD group?
Yes. This was really interesting. A specific finding just for the subjective cognitive decline group. They found what they called a significant interaction between cognitive status and the Eichner classification when looking at MoCA scores.
The MoCA test.
Yeah.
That's a common cognitive screening tool, right?
Yeah.
Measures memory, attention, spatial skills.
Exactly. And what they found was only in the SCD group, people with poorer occlusal support, Eichner B or C, had significantly lower MoCA scores than SCD folks with good support, Eichner A.
Wow, so only in the group that just feels like something's off, not in the MCI or AD groups.
Correct. That specific link wasn't significant in the more advanced stages in their analysis.
What do the authors think that means?
They suggest it might reflect early changes in certain cognitive areas measured by MoCA, perhaps things like spatial abilities, and critically, they propose that assessing occlusal support could potentially serve as an early indicator of cognitive vulnerability, specifically in that preclinical SCD stage.
That's powerful. For a dentist, assessing someone's bite could potentially flag someone who's only just starting to have subjective concerns.
It adds a whole new dimension to that chairside assessment, potentially.
Okay. What about the other things they measured? Saliva,
Yeah.
perio.
Trends were noted for some. Poorer chewing performance and higher DMFT scores, as we said, tracked with severity. Reduced saliva flow, or hypofunction, also trended towards being associated with progression.
And periodontal disease, often linked to inflammation, which we know can affect the brain.
Yeah, that's where this study was a bit different from some others. Here, the main periodontal measures, PPD, CAL, bleeding on probing, were not significantly associated with the cognitive diagnosis across the groups.
Interesting. Why might that be?
The authors acknowledge it differs from some prior research. They suggest maybe differences in the study population or how things were measured could play a role. It warrants more investigation.
Okay. And I remember seeing something about the plaque index showing an inverse trend. That sounds backwards.
It does sound counterintuitive.
Yes.
Plaque index showed a non-significant trend where lower plaque was associated with more severe cognitive decline.
How could that be?
The author speculated it might be because people in the later stages, like AD, are more likely to be receiving help with oral hygiene from caregivers. So paradoxically, their plaque scores might actually be lower than someone in, say, the MCI stage who is struggling with dexterity but doesn't have help yet.
Ah, okay, that makes sense. It highlights how complex interpreting these things can be, especially later on.
Definitely.
So let's pull this all together. For the dentists listening, what are the big clinical implications, the take-home messages from this study?
Well, the study itself states it pretty clearly in the clinical significance part. These findings, they say, underscore the clinical relevance of routine oral assessments and timely prosthetic rehabilitation in mitigating cognitive decline.
That's the headline, really. Oral health isn't just for the mouth, it might be for the brain, too.
Absolutely. That strong link between unrestored missing teeth and MCI aid is a huge point. It suggests dentists should really prioritize finding solutions to replace missing teeth, not just note the gaps.
Active replacement seems key.
Yes. And remember the finding that any rehab seemed to weaken the link? That's encouraging.
But the authors seem to lean towards fixed options, if possible.
They did, based on the discussion around sensory feedback. While removable dentures are better than nothing, the idea is that fixed prostheses, connected to bone via teeth or implants, maintain that direct tactile input through the ligaments.
That sensory connection we talked about.
Right. And that input, they hypothesize, might be particularly important for cognitive function. So yeah, prioritizing fixed options when it's clinically feasible for older adults, especially those raising cognitive concerns, seems supported.
Replace teeth good. Restore that sensory input, maybe even better.
That's the potential implication. And of course, maintaining occlusal support. Those Eichner findings are critical.
Assess and preserve or restore those biting zones.
Yes, especially in the back. It's not just about chewing food efficiently. It seems tied into brain health pathways somehow.
And connecting back to that really specific finding in the SCD group.
The link between poorer occlusal support and lower MoCA scores only in those with subjective complaints.
Yeah, that's a potential game changer for early detection, isn't it?
Potentially, yes. Evaluating occlusal support in patients who say, "Doc, I just feel like my memory isn't what it was," could be an early indicator of cognitive vulnerability. It's an oral sign that might warrant a conversation, maybe suggesting they follow up with their physician.
This whole study really hammers home that oral health isn't isolated, is it? It's deeply connected to systemic health, brain health included.
For sure. It means routine dental checks are more than just checking for cavities or gum disease. They're potentially opportunities to spot individuals who might be at higher risk of cognitive decline based on what's happening in their mouth.
Which could change how dentists talk to their patients, couldn't it? And maybe encourage more collaboration with doctors.
Absolutely. It suggests that when treatment planning for older patients, dentists should think beyond just chewing and looks. They should consider these potential broader impacts on cognitive health.
So prioritizing treatments that maintain or restore functional occlusion and making sure missing teeth get replaced effectively, that takes on even more importance.
That seems to be the strong message from this research.
Okay, so to wrap up, this a deep dive into the Wu et al. Article in the Journal of Dentistry shows a compelling link between specific oral health issues, particularly losing natural teeth, not replacing them, and having poor biting support, and the increasing severity of cognitive decline along that whole Alzheimer's continuum.
And for you listening, especially if you work in dentistry or are interested in healthy aging, this study really bolsters the idea that comprehensive oral assessments and crucially timely and effective prosthetic rehabilitation might be relevant factors in the bigger picture of managing cognitive aging.
It certainly provides some food for thought.
Definitely. And it raises a final question, doesn't it? Given this connection they observed, how might proactive dental care, with a real focus on restoring functional occlusion, become an even more vital part of maintaining overall health and potentially slowing down cognitive decline in our aging population?
And what does this mean for future teamwork between dental and medical professionals? How can they collaborate better on this mouth-brain connection? Something important to chew on.